If you continue to consume these 22 foods, your kidneys will not recover. You cannot continue to eat the same foods after developing kidney problems. Refined foods must be avoided, sugar must be eliminated, and you must stop consuming anything from cans or boxes as well as fast food. You'll find yourself with a very long list of items you can't consume, some of which you might be surprised to learn are actually incredibly nutritious. This video lists every food that someone with renal illness should avoid. We also provide excellent substitutes or advice on how to continue enjoying these foods without jeopardizing kidney health. You should definitely watch it through to the conclusion because the meal options will vary based on the kind and stage of kidney disease you have. Remember that 90% of individuals with kidney disease don't even realize they have it because of nebulous symptoms. So if you think your kidneys are fine and there's nothing you can do about it, think again. The issue with diseased kidneys is that they are no longer able to filter certain substances well, including salt, potassium, phosphorus, and oxalates. A consistent diet heavy in these minerals can eventually cause severe renal disease, depending on how fragile your kidneys are. Given the discussion of these minerals, we believe it is imperative to dispel a myth regarding kidney health. Some people think that a damaged kidney is incapable of filtering certain compounds, such as salt, potassium, and phosphorus. They consequently believe that these compounds are dangerous and that renal disease can be avoided by lowering them. This conclusion is invalid, though, because minerals are necessary for good kidney health as well as general health. I'll say it again. Salt, potassium, and phosphorus must be consumed on a regular basis for kidney health. However, you might have to restrict them if your kidneys aren't doing well. Kidney disease, as you can see, is complicated. This is why it's so important to know how your kidneys are doing. And the best way to do so is to get personalized guidance from your doctor. It's also important to take preventative measures because many people are unaware that they are at risk for renal disease. You can find some useful advice on how to maintain kidney health and prevent kidney disease in the second part of the movie. Stated differently, you will possess all the necessary knowledge to maintain the health of your kidneys. Before we get started, please be aware that every piece of information in this video has been impartially fact-checked and examined by trained experts. Okay, let's get back to the foods that can seriously damage your kidneys. Avocados are definitely nutritious, tasty, and creamy. Minerals, vitamins E, K, and C, and monounsaturated fats are abundant in them. However, you may want to limit your avocado consumption if you have kidney problems. Avocado's primary drawback is their relatively high potassium content. Potassium normally helps to maintain homeostasis in our bodies by supporting healthy blood pressure, muscles, and neurons. Our kidneys are generally very good at controlling excess potassium in the blood, but in those with renal problems, the kidney's inability to efficiently eliminate excess potassium results in hyperkalemia, an excess of potassium in the blood. Unchecked hyperkalemia can lead to major problems for the heart and muscles. Limiting potassium is commonly recommended in renal disease guidelines, albeit the precise dosage varies. For this reason, it is best for kidney patients to consult their physician about what their optimal potassium consumption is. Less than 2,000 to 3,000 milligrams of potassium per day is typically the goal for those following a diet low in potassium. About 33 to 48% of this potassium is found in an average avocado, which has a potassium content of 975 milligrams. Even more worrisome, avocados have a lot of calories, even though they are packed with nutrients. Eating too many avocados can result in weight gain, which is linked to a higher risk of kidney disease. Avocados contain more than 300 calories per fruit. Put simply, having excess weight increases the workload for your kidneys, making them work harder to eliminate pollutants. Additionally, being overweight raises your risk of kidney diseases due to diabetes and high blood pressure. After all, it's a good idea to limit your avocado intake if you have kidney problems. Eat no more than 1/4 of an avocado at a time. This is an excellent advice. This allows you to consume less potassium while still benefiting from its nutritional properties. In the next section, we'll discuss various low potassium foods that you can combine with it. Another method is to boil or peel your avocado. then soak it in water for 2 hours. With this method, potassium can be reduced by as much as 50%. So far, are you having fun with our video? If so, kindly leave us a like and we'll create more content along these lines. Banana. It's well knowledge that bananas promote heart health, aid in weight loss, provide you natural energy, and balance your digestive system. But potassium is also abundant in this superfood. The blood's potassium levels are balanced by a healthy kidney. On the other hand, individuals who have had kidney injury or chronic kidney disease, CKD, for a minimum of 3 months ought to restrict their consumption. For reference, the National Kidney Foundation in the United States suggests that individuals with chronic kidney disease, CKD, consume 2,000 milligrams of potassium daily, about 7 inches long. A medium-sized banana has about 422 milligrams of potassium. That corresponds to 21% of the daily allowance that is advised if you have renal illness. Although this may not seem like much because of their delicious flavor and low calorie content, individuals frequently eat several bananas at once. Then blood potassium levels can rise quickly, leading to hyperkalemia in those with renal disease. Weakness, numbness, exhaustion, nausea, irregular heartbeats, and in extreme situations, cardiac arrest might result from this. You might start by selecting smaller bananas and limiting yourself to just one per day to control your potassium consumption. Another piece of advice is to briefly boil or soak bananas in water to lower their potassium level. This process might, however, also remove other minerals and vitamins. If you enjoy banana flavor, think about adding it to juices or smoothies that include other fruits that are lower in potassium. Apples, berries, cherries, grapes, pineapples, watermelons, pears, plums, and peaches are all good choices. They can assist you in keeping taste and renal health in check. It's crucial to remember that dried fruits like raisins or prunes, as well as cantaloupe, apricots, and honeydew, are all rich sources of potassium. For the sake of your kidneys, it is therefore advisable to consume them in moderation. The research that back up our assertions are available for viewing via the link in our description box for anyone who are interested in the proof. Apricots. In the later stages of kidney illness, apricots are usually avoided because they are high in potassium. There are 90.6 milligrams of potassium in one apricot. Consuming foods high in potassium, such as apricots, on a frequent basis might elevate blood potassium levels in kidney patients. Weakness, numbness, exhaustion, and nausea may result from this. Elevations of potassium in the blood might even lead to arrhythmias or cardiac arrest in extreme situations. Therefore, it makes sense to eat apricots after speaking with a dietitian. Peaches and plums, in addition to apricots, are high in potassium, so if you have renal disease, stay away from these fruits, especially when they're dried. Oranges are nutritious citrus fruits that are high in fiber, antioxidants, and vitamin C, all of which are very good for our health. However, because of their high potassium content, oranges might not be a good choice for those with kidney issues. A medium orange, about the size of a small hand, has about 237 milligrams of potassium, just like an avocado. While this might not seem like much, eating more than one orange or drinking orange juice can quickly cause you to consume more potassium than you should each day. About 496 milligrams of potassium may be found in 1 cup of orange juice, which translates to 1,240 milligrams in 500 milliliters, or almost 1 pint of the juice. Eating foods high in potassium, such as oranges, on a frequent basis can exacerbate hyperkalemia in individuals with chronic kidney disease. As we have described with avocados, you may experience fatigue, numbness, weakness, and nausea from hyperkalemia. Severe hyperkalemia may possibly result in arrhythmias or cardiac arrest. Furthermore, because oranges contain a lot of oxalates, consuming an excessive amount of them may raise your risk of kidney stones. The following section will have further information. Orange juice is still okay to drink occasionally. It has less oxalates than whole oranges. Making juices from less oxalate-containing fruits, such as berries, pears, cherries, apples, and grapes, is a safer option. An added benefit is that these fruits have lower potassium content than oranges, fruits that are dried. Because they have lost their water content, dried fruits are delicious and appear to be nutrient dense, but they're also high in calories, sugar, and potassium, which may be harmful to your kidneys. As to the USDA, a single cup of pitted raw prunes has 1,270 milligrams of potassium, which can fulfill half of your daily potassium needs if you have renal disease. Furthermore, it might not be a good idea for your kidneys to remove the water content from fresh fruits. Water consumption is important for kidney function. Fresh fruits give you a greater feeling of fullness than dried fruits since they lose water when they dry out. In addition, some dried fruits have additional ingredients, sugar and salt added to improve flavor. When your kidneys filter blood, these substances will put them under extra strain. Regularly eating dried fruits can put too much strain on your kidneys. Because dried fruits are small and convenient for snacking, it's also easy to overindulge in them, which can lead to overindulging in calories unknowingly. Furthermore, a lot of the fruit's water content is lost during the dehydration process, so you might not feel as full as you would with fresh fruit. Therefore, if you want to keep your kidneys safe, it's recommended to limit your snack options to fresh fruits. Broccoli. Thoughts are often given to the health advantages of leafy greens like spinach, but there are also possible concerns that should be considered, particularly with regard to kidney health. The oxalate concentration of spinach is the primary concern here. Kidney damage, excruciating pain, blood in the urine, nausea, vomiting, and crystallization of oxalates can result in kidney stones. You run the risk of dying from this chemical if your body absorbs too much oxalate in a short amount of time, even from a single meal. A case has been reported in which an individual had oxalate-rich sorrel soup. Some hours later, their kidneys failed and they died. You can build up oxalates in your body even with a moderate daily consumption, which can lead to kidney stones, bladder stones, kidney nephropathy, joint problems, and damage to all organs, including the brain. They are also connected to diseases like painful bladder syndrome, also referred to as interstitial cystitis or IC. Higher than many other leafy greens, a serving of 100 Grammys or half a cup of spinach can contain up to 2,350 milligrams of oxalate. Scientists observed the diets of around 240,000 participants over several years in a research. It was discovered that more than 40% of these individuals' oxalate intake came from spinach. If you have kidney issues, you should stay away from foods like cassava root, amaranth leaves, chard, beetroot leaves, starfruit, and rhubarb because they also contain significant amounts of oxalate. Returning to spinach, it has a high potassium content. Up to 558 milligrams of potassium can be found in 100 grams of raw spinach. As we discussed in the section on avocados, people with kidney disease may find it difficult for their kidneys to filter potassium. Thus, a kidney patient may develop hyperkalemia, a disorder that damages the heart and muscles if they consume excessive amounts of spinach or potassium. It should be noted that, unlike avocados, boiling spinach does not lower its potassium or oxalate content. Therefore, whether or not you have kidney illness, you should consume spinach in moderation based on your health. Spinach is undoubtedly a superfood. If you balance it with other low oxalate and low potassium vegetables such as kale, carrots, zucchini, lettuce, cabbage, broccoli, and cauliflower, you can still include spinach in your diet. Sweet potatoes are a superfood because they are full of vital vitamins, minerals, and amino acids. However, be aware that a high potassium level can be harmful to those who have renal impairment. A typical baked potato contains approximately 610 milligrams of potassium, whereas a sweet potato that is about 5 inches long can contain 438 milligrams, according to the United States Department of Agriculture, or USDA. In contrast to spinach, potatoes can benefit from having their potassium levels lowered by soaking them in water before cooking. For the protection of your kidneys, it is therefore advisable to be cautious and soak your potatoes and sweet potatoes before cooking. Additionally, common potato foods like chips and French fries have a lot of salt and sodium, which strains the kidneys more. You might quickly exceed your daily salt limit by snacking on them. Furthermore, because potato chips are so heavily processed, they typically have very little to no nutritional value. Therefore, it's advisable to avoid them all. Tomatoes are a great source of antioxidants, fiber, vitamins, and minerals that help prevent cancer. But individuals with kidney disease should be aware that tomatoes contain a lot of potassium. Up to 237 milligrams of potassium can be found in just 100 Grammys of ripe tomatoes. Additionally, the amount of tomatoes that persons with kidney disease consume varies on the severity of their kidney damage. Examples of tomato products include sauce, gravy, and ketchup. Speak with a licensed healthcare provider or registered dietitian to determine what's best for you. Relish and pickles. One old way to keep fruits and vegetables fresher longer is to ferment them. In addition to improving flavor, this technique encourages the development of probiotic bacteria for a healthy stomach. But foods that have undergone fermentation, such relish and pickles, are high in salt. One large pickle, for instance, has 1,630 milligrams of salt. This quantity is greater than half of what is advised for kidney patients. In a similar vein, 1 cup of the popular fermented meal, kimchi, has 747 milligrams of sodium. Consequently, if you're concerned about the health of your kidneys, it's necessary to consume fermented foods in moderation. Cola. Soda is just sugar, and consuming sugar in liquid form is far more hazardous than in solid form. Your kidneys begin to leak sugar into the urine when your blood sugar level is too high. This is usually not an issue if your kidneys are in good shape. However, consuming too much sugar can harm your kidneys if you have diabetes. Nephrons are, in short, microscopic filters found in the kidneys. Diabetes' elevated blood sugar can harm these blood arteries and filters, which makes the kidneys work harder. Furthermore, ingesting sugar in solid form is healthier than drinking sugary liquids like soda. People frequently choose diet soda because they believe it to have less sugar in it. However, many are unaware that consuming diet soda on a daily basis is associated with a 67% increased risk of type 2 diabetes. Diet Coke still has artificial sugars and chemicals which are more harmful to your kidneys. When it comes to sodas, they frequently have high phosphorus flavoring and shelf life ingredients. A high phosphorus diet can cause severe kidney damage. Sodas contain more phosphorus that is absorbed than phosphorus from natural sources. For normal kidney function, the National Kidney Foundation recommends consuming no more than 700 milligrams of phosphorus each day. It is now advised to reduce soda consumption in order to protect your kidneys. Beverages. Because alcohol is harmful, excessive alcohol use is closely linked to renal dysfunction. It can lead to inflammation and impair renal function, which increases the body's burden of toxins. Additionally, alcohol may raise your risk of dehydration and low blood sugar, both of which are detrimental to your kidneys. Drink plenty of water and limit your alcohol intake if you want to maintain the health of your kidneys. Depending on your conditions, your healthcare professional can help you determine how much and how often alcohol is safe for you to consume. Nuts and almonds. Nuts are a great source of healthful fats, oils, and protein. However, those with kidney problems may be adversely affected by the potassium and phosphorus content of nuts. Consider almonds as an example. Approximately 23 almonds, or 1 ounce, has 208 milligrams of potassium and 136 milligrams of phosphorus. Similarly, 1 ounce of cashews contains approximately 16 to 18 grams of potassium and 168 milligrams of phosphorus. So if you have kidney health issues, even nutritious snacks like nuts should be ingested in moderation. Almonds are now a little riskier. Consuming almonds can raise the risk of kidney stones, particularly in those with a medical history of renal disease. This is due to the high oxalates content in almonds. 469 milligrams of oxalates are found in 100 grams of almonds, or roughly 3 modest handfuls. Ordinarily, oxalates leave our bodies in the stool after binding with calcium. On the other hand, oxalate can enter our bloodstream if we eat too much of it and not enough calcium. It eventually ends up in our pee. When oxalates bind with calcium in the kidney, they can form crystals that eventually turn into stones, especially if your kidneys aren't working properly or if your urine is extremely concentrated or acidic. Over 80% of kidney stones are calcium oxalate stones, as they are called. Acute oxalate nephropathy is the term for the rapid accumulation of oxalate stones in the kidneys. Acute renal failure may arise from this illness if kidney tubule cells are damaged. Studies have discovered instances of oxalate nephropathy connected to peanuts, which contain roughly 187,000 milligrams. Given that almonds have 2.5 times the amount of oxalates as peanuts, should you completely avoid almonds? Not always, but it's a good idea to indulge in them sparingly, merely a handful or two each day. In addition, oxalates are abundant in cashews, peanuts, pistachios, and walnuts, albeit in smaller quantities than in almonds. Thus, it's essential to exercise restraint when around them. It's best to speak with your doctor for specific advice. Cocoa has positive effects on heart, brain, and emotions. It may even help with diabetes. However, renal patients should be aware that 500, 900 milligrams of oxalates are present in 100 milligrams of cocoa powder, which is an extremely high amount. Additionally, cocoa has a lot of phosphorus, which is bad for people with kidney disease. Increased amounts of phosphorus can cause harmful calcium deposits in the heart, lungs, eyes, and blood vessels. This may lead to arterial hardening over time, raising the chance of a heart attack, stroke, or even death. Rich in oxalates, phosphorus, and potassium are cocoa-based sweets such as chocolate, chocolate milk, and chocolate syrups. These goods frequently have extra sugar and salt, which puts further strain on your kidneys. As we previously stated, there are those who believe that the caffeine in cocoa beans increases the amount of urine produced, increases the danger of dehydration or calcium loss, and increases the risk of kidney stones. However, research indicates the contrary. Moderation is crucial if you want to enjoy your cup of chocolate milk in a balanced way. You can choose beverages like juices, milk, or just plain water that have less oxalate in them. Additionally, you might want to use carob powder as a cocoa powder alternative for kidney health. Generally speaking, carob has the same flavor as cocoa, but less oxalates. Additionally, carob contains 3 times less potassium and 9 times less phosphorus than cocoa. On the other hand, if you are following a low oxalate diet, you will probably need to avoid chocolate and other foods high in oxalate until your body recovers. Across the world, rice is a staple food that goes with almost every meal, but surprise, that seemingly harmless plate of rice could be hiding something poisonous. In short, rice contains a lot of arsenic, a heavy metal that causes kidney damage. Chronic renal insufficiency and abrupt renal failure are 2 conditions that can result from arsenic poisoning. The more dangerous kind of arsenic, known as inorganic arsenic, can be found in raw rice at concentrations of between 0.1 and 0.4 milligrams per kilogram. Other cereals, such as wheat and barley, have a total arsenic level of only 0.03 to 0.08 milligrams per kilogram, and their inorganic arsenic content is frequently undetectable. More cadmium and other heavy metals are also often absorbed by rice than by other crops. Does this imply you should stay away from all rice? Not always. Because a healthy diet is all about balance, you can still enjoy it in moderation. While eating rice once in a while is okay, it's recommended to avoid doing so too frequently, especially for young children and babies. Children's brain development, IQ, and memory may be impacted by even modest levels of exposure to arsenic, as they can ingest up to 3 times the amount of the mineral from rice as adults. In light of this, you might want to consider low arsenic substitutes for brown rice, such as quinoa, barley, couscous, buckwheat, millet, farro, and sorghum. Butter. The fat and protein components of milk or cream are used to make butter, a dairy product. Thus, cholesterol and saturated fat make up this delicious delicacy. These substances have been connected to plaque development and high blood pressure, which can eventually narrow the blood veins in your kidneys and affect renal function. And as if that wasn't bad enough, we also have salted butter. About 643 milligrams of salt is present in 100 grams of salted butter, which is a lot of salt. A diet heavy in salt will raise blood pressure, which over time may cause kidney damage. Furthermore, butter from stores is frequently highly treated in order to enhance flavor and prolong shelf life. This method takes away important components from butter, such as calcium, leaving it with very little nutritional value. To maintain the health of your kidneys, think about using unsalted organic butter, and always remember that moderation is the key. Crackers and pretzels, popular snacks like pretzels, are heavy in added salt and sodium and have little to no nutritious value. It's common for people to eat more sodium when snacking than they are allowed to each day. A healthy diet should have less than 2,300 milligrams or 2.3 gram maize or half a teaspoon of sodium per day, according to the National Kidney Foundation. Consuming a lot of sodium raises blood pressure, which over time may cause kidney damage and stones. Therefore, it's always a good idea to read the snack labels to avoid eating too much salt. Foods in cans and freezers, foods like soups, veggies, meats, and seafood that can be canned are widely consumed due to their ease of preparation and convenience. But because canning technology needs salt as a preservative to increase shelf life, the excessive sodium concentration causes kidney damage. Remember that frozen foods like fish and veggies frequently include more salt. One large serving of these convenient goods can exceed your daily salt allowance of 2.3 grams. If your family already eats these highly processed foods as staples, think about replacing them with fresh ones. Meat in a processed tin. Any type of meat, including muscle, offal, fat, and flesh, can be preserved and given additional flavor by curing, processing, smoking, or fermenting. The majority of processed meats, including pepperoni, hot dogs, sausages, beef jerky, and corned beef, can have high levels of phosphorus and sodium. The precise quantity is determined by their processing techniques and additives. The issue is that consuming too much salt and phosphorus can cause severe kidney damage. For normal kidney function, the National Kidney Foundation recommends consuming no more than 700 milligrams of phosphorus each day. It's advisable to stay away from processed meats altogether because they have been connected to cancer and other chronic illnesses. Legumes such as beans and lentils are excellent providers of fiber, vitamins, and other minerals in addition to plant-based protein. However, those who have kidney issues should use caution when consuming the superfood. Phosphorus and potassium levels are high in legumes. For instance, a cup of cooked or boiling pinto beans has 746 milligrams of potassium and 251 milligrams of phosphorus. When renal function is compromised, potassium and phosphorus might accumulate in your body, harming your blood vessels, bones, and other organs. When consuming beans, use caution and make sure they're cooked properly to minimize any potential negative effects if you have renal issues. Cheese. Dairy goods are a great source of protein, calcium, and vitamin D. Examples of these items include cheese, milk, and ice cream. They do contain a lot of potassium and phosphorus, though. For instance, 390 milligrams of potassium and 252 milligrams of phosphorus can be found in 1 cup of milk with 2% milk fat. This quantity is excessive for kidney disease. Saturated fats, which put additional strain on your kidneys, are also included in some dairy products. Therefore, even though dairy is safe in moderation, especially when part of a balanced diet, it's best to avoid it if you have renal problems. Whole grains. Grains typically consist of 3 layers. The outermost layer of whole grains, known as bran, is a great provider of potassium and phosphorus. About 208 milligrams of phosphorus and 174 milligrams of potassium can be found in a cup of brown rice. A cup of white rice, on the other hand, contains roughly 54 milligrams of potassium and 69 milligrams of phosphorus. This indicates that the phosphorus and potassium content of white rice is only roughly 1/3 that of brown rice. Thus, it may be preferable to choose refined grains over bran cereals and brown rice if you have mild to severe kidney illness. This is particularly true for whole wheat bread, which is the second food item on our list. Bread made with whole wheat. Nowadays, a lot of people think whole wheat bread is better for you than regular white bread. Whole wheat bread is unique in that it contains fiber, vitamins, and minerals. However, white bread should be preferred for kidney health. This preference results from whole wheat bread's higher phosphorus and potassium content. Foods high in potassium are not beneficial for kidney sufferers, as we have discussed in previous sections. Phosphorus is an additional issue. Phosphorus isn't normally a problem for those with healthy kidneys because the kidneys remove excess phosphorus from the blood. However, things are not the same for people who have renal disease. Due to ineffective renal filtering, their blood phosphorus levels are elevated. Your body may gradually lose calcium as a result of this, resulting in brittle and thin bones. Then you may experience joint and bone discomfort, cramping in your muscles, and itchy skin. Just 28 grams or one slice of whole wheat bread can provide approximately 81 milligrams of potassium and 67 milligrams of phosphorus. Even though it seems like a small amount, most individuals eat more than one slice. That's twice as much if you're making a sandwich. On the other hand, a typical piece of white bread has roughly 64 milligrams of potassium and phosphorus. Dairy products, whole grain bread, bran cereals, muesli, almonds, and sunflower seeds are among the other foods high in phosphorus. As there is no recommended daily intake of potassium for those with kidney illness, it is crucial to speak with your physician or nutritionist to determine how much of these foods are appropriate for you. The potential health risks associated with whole wheat bread for your kidneys go beyond phosphorus. Bread can exacerbate kidney problems such as anemia, which is characterized by a low red blood cell count. In other words, iron and other vital nutrients that are necessary for the production of red blood cells are not well absorbed when a person has kidney disease. Phytates included in whole wheat bread bond to iron and inhibit its absorption further. Thus, for those suffering from kidney ailments, whole wheat bread may exacerbate anemia. Commercially manufactured bread also has extra sugar and salt to improve flavor and texture, which is bad for your kidneys. An excessively salty and sugary diet can increase blood pressure, which is a significant risk factor for renal disease. Extra pressure on the kidneys is caused by high blood pressure. This strain has the potential to harm kidneys over time. That's our list of 22 common meals that can damage unhealthy kidneys. Folks, the majority of these items have a place in a well-balanced, nutrient-rich diet, despite the fact that they can be harmful to an unhealthy kidney. Thus, it's all about moderation, variety, and balance, especially for those who have renal issues. Since every food has both positive and negative aspects, choosing wisely can help maintain both your general health and renal health. Eat healthfully and worry-free, and lead a joyful, contented life. Taking into account your particular demands and health, carefully analyze our list of 22 foods that can harm your kidneys. Creating a customized eating plan under the direction of a licensed healthcare provider or dietitian is the best option. Recall that the daily allowances for oxalate, sodium, potassium, and phosphorus are as follows. We'll now go over some additional advice on designing a healthy diet for your kidneys. First, make an effort to consistently eat meals high in protein throughout the day. Foods high in protein include eggs, fresh pork, fish, and chicken. Drinking coffee, tea, green tea, water, or any other beverage at room temperature is another beneficial suggestion. Maintaining your fluid intake will also assist you in better caring for your kidneys. Check food labels for oxalate, sodium, potassium, and phosphorus amounts when you go shopping. Here's a quick tip. Foods that are packaged and processed are typically not as good for your kidneys. You have greater control when you cook at home. Herbs and spices can be used to flavor food instead of sugar or other unhealthy additives. Additionally, cooking at home helps you better control how much salt you eat. We've got some additional tips to help you give your kidneys a good cleaning after reading these. You may already safeguard your kidneys simply by choosing the appropriate drinks to consume. What is known about health issues that you are unaware of? A guide on natural fruit juices for kidney health and detoxification will soon contain some of them. However, before we do that, let's make sure that we both understand what a cleanse entails, as this has been a contentious issue in the medical community. Some claim that since our kidneys naturally filter our bodies, we don't need to take any additional steps. However, unhealthy eating and lifestyle choices can overwhelm our kidneys with poisons such as free radicals and heavy metals, leading to severe kidney disease. For additional information, watch our prior video where we go into more detail about this. But keep in mind that in order to get rid of any waste that hasn't been completely drained out, we need to offer our kidneys extra support. To put it another way, we can and should clear our kidneys of excess toxins. However, throw away any fancy pills or 3-day regimens for kidney cleansing. Let's keep things basic and organic for the time being, and we'll clarify why later. Eating more meals high in antioxidants is the best thing you can do for your kidneys. The main contributors to kidney disease, free radicals, are dangerous chemicals that antioxidants assist your kidneys remove from your body. Thus, increasing your consumption of antioxidants is essential to help with kidney cleansing. Fortunately, a variety of natural juices include antioxidants, and we're here to help you choose the best options. We have all the information you need, from comprehending these active ingredients to discovering how to make and enjoy kidney-friendly beverages. Apple juice is a popular option since apples are not only tasty but also highly nutritious and adaptable in production. However, did you know that drinking apple juice could aid in kidney cleansing? Apple juice keeps you hydrated and aids in the removal of pollutants due to its high water content. In addition, apples and apple juice contain a wealth of nutrients, including vitamin C, polyphenols, and dietary fibers like pectin. Apple fiber encourages a healthy digestive system, which lessens the burden on your kidneys. Now, free radicals can damage your cells, but phytochemicals, particularly polyphenols, have antioxidant qualities that help prevent this from happening. Thus, the next time you sip on some apple juice, you're not only enjoying a delightful beverage, but also supporting the continued health and strength of your kidneys. Researchers discovered that consuming apple juice may reduce the incidence of kidney stones caused by calcium oxalate in a clinical study. For a mere 5 days, 9 in good health drank 2 to 4 cups of apple juice a day. And how did it turn out? Certain forms of kidney stones were less likely to occur in their urine samples. However, remember to drink apple juice in moderation, especially if you have renal problems, before you start downing glasses full of it. Some store-bought apple juices contain a lot of sugar, so diabetics might want to avoid them. Additionally, choose apple cider vinegar, or ACV for short, a vinegar beverage created from sugar and fermented apple yeast for kidney health. In addition to balancing blood sugar, ACV can help dissolve kidney stones and avoid oxidative stress. Select an organic and high-quality brand to maximize the benefits of your ACV. Fortunately, even the highest ACV won't break the bank. To support health, particularly kidney health, 1 to 2 tablespoons or 15 to 30 milliliters of apple cider vinegar, ACV, mixed with water should be consumed daily. Spreading this out throughout the day is ideal, and it's a good idea to start modest and see how your body responds to it. Juice made from cranberries. In North America, cranberries are found on evergreen shrubs. Great kidney-friendly components like quinic and salicylic acids can be found in these dark red fruits. Furthermore, by promoting a healthy urinary system, warding off UTIs or urinary tract infections, and maybe averting the development of kidney stones, cranberry juice may help cleanse the kidneys. In other words, the abundance of antioxidants in cranberry juice helps keep bacteria from adhering to the urinary tract. This characteristic may aid in lowering bodily inflammation and the chance of getting a UTI. Proanthocyanidins is one of the main active ingredients in cranberry juice that helps prevent UTIs. PACs, as they are also known, these polyphenols, PACs, are potent antioxidants that also have antibacterial, anti-inflammatory, and anti-cancer qualities. They are essential for maintaining general health and protecting against oxidative stress. Cranberry juice has also been demonstrated to lower blood pressure and cholesterol, which is beneficial to kidney function because kidneys filter blood. It's crucial to remember that although cranberry juice may reduce brushite stones, it may raise the chance of oxalate and uric acid stone development to other types of kidney stones. Thus, keep in mind to sip it responsibly. Beetroot juice is a vivid and delectable beverage obtained from pressing beetroot, the deep red root vegetable commonly seen in grocery stores. Beetroot juice is a rich source of important minerals and chemicals that help maintain healthy kidneys. Among these incredible substances is inorganic nitrate, which has been demonstrated to assist in blood pressure regulation and may possibly have positive effects on kidney function. Researchers looked at how beetroot juice affected the blood pressure of 60 adults with renal disease in a clinical investigation. According to the study, beetroot juice can lower blood pressure by enhancing blood vessel health. Beetroot juice may help maintain kidney function, especially for those with hypertension and kidney illness, according to this study's compelling data. Thus, the next time you're having a meal, how about having a cheese sandwich with a side of beet juice, crumbling feta cheese over spinach salad, or just some beets and cottage cheese? It's a tasty method to help your kidneys function better. Juice from lemons. Due to its naturally occurring sour citrus flavor, lemon juice is often used as a natural kidney cleanser. To put it simply, lemon juice contains hydroxycitrate, or HCA, which is highly effective in reducing the formation of kidney stones. HCA and citric acid inhibit the crystallization of new minerals and prevents minerals from adhering to already formed stones. For instance, citrate and calcium combine to inhibit the production of stones. Studies indicate that ingesting the juice of 2 lemons or half a cup of concentrate lemon juice mixed with water on a daily basis can increase urine citrate levels and perhaps reduce kidney stone risk. Half of the 203 individuals in a trial who had previously experienced kidney stones caused by calcium oxalate received lemon juice twice a day. Compared to the non-lemon juice group, the former experienced fewer recurrences of stones over a 2-year period. It should be noted that including lemon juice in your diet may help avoid the recurrence of kidney stones, but consistency is essential for best results. To maintain your health and avoid stones, continue drinking lemon juice every day after you start. Just keep in mind that because lemon juice is so acidic, moderation is the key to preventing tooth erosion. Lime juice, which is derived from the lime fruit, has health benefits for the kidneys in addition to being a flavor enhancer. Lime juice, which is high in citrate, is an important kidney stone preventive because it prevents kidney stones, particularly calcium-based ones, from forming and urinary crystallization. To put it simply, lime juice increases urine citrate levels, which binds to calcium oxalate crystals and stops them from growing and aggregating. In addition to citrate, lime juice contains high levels of antioxidants such as flavonoids, polyphenols, and ascorbic acid, which lower oxidative stress and benefit kidney health in general. Lime juice's function in kidney stone therapy and prevention is further supported by studies showing the efficiency of citrate in reducing kidney stone size, one of which was reported in the Cochrane Database System review. Limeade, which combines the zesty, refreshing taste of lime juice with water and your preferred sweetener, is a delightful way to enjoy lime juice. Lime juice can also be used as a flavoring in a variety of recipes, giving salads, marinades, sauces, and seafood meals a zesty twist. In terms of quantity, adding 1 medium lime to your diet each day might provide your kidneys a substantial boost in vitamin C and other vital nutrients. Juice from celery. Health-conscious people frequently choose celery since it is a crisp and nutritious vegetable that is frequently commended for its antioxidant and anti-inflammatory characteristics. By chopping celery stalks into tiny bits and mixing them with water until smooth, you can make your own celery juice. To get the most nutrients, squeeze the celery juice through a strainer and consume right away. You can add ginger, cucumber, fresh mint, or lemon juice for different taste. What, though, makes celery juice unique? Celery reduces cholesterol and blood pressure, which may benefit your kidneys inadvertently. Apigenin is a particular flavonoid found in celery extracts that may offer protection against kidney injury. The ability of the cell extract to shield cells from harm, or its cytoprotective qualities, raises the possibility that kidney health may also benefit. However, despite its widespread use, not much human study has been done to substantiate the claim that celery juice helps with kidney cleansing. However, adding celery juice to your diet will provide your kidneys with a low potassium, high in nutrients veggie. Juice from cucumbers, melons, squash, and pumpkins are members of the Cucurbitaceae family, which also contains cucumbers. They have long been a mainstay of conventional Indian medicine. Cucumbers help your kidneys filter toxins because of their high water content and low calorie content. Cucumbers are a great source of several nutrients, including vitamins, minerals, and antioxidants. These nutrients support a healthy internal environment, shield your cells from harm, and aid in the removal of contaminants. Cucumber juice also removes toxins and trash from your body like a virtual broom because to its high water content. In addition, cucumber seeds have a cooling impact and can help keep you from being constipated, which will keep your kidneys and stomach happy and healthy. Not only that, but cucumber juice also prevents kidney stones. Because of its high fiber and water content, regular consumption is thought to aid in the dissolution of kidney stones. Cucumber juice is a promising addition to any kidney-friendly diet because of its hydrating and anti-inflammatory qualities, even though scientific research on its direct effects on kidney health is currently limited. Just keep in mind that it cannot take the place of medical counsel or care, particularly if you have kidney problems. Juice from parsley. The Apiaceae family includes parsley, a nutrient-dense plant that has several health benefits and antioxidants. Since ancient times, parsley has been praised for its great healing properties and utilized medicinally in many European, Mediterranean, and Asian nations due to its rich nutritional profile. More precisely, parsley is a commonly used therapeutic herb for urolithiasis, which is the disease where kidney stones grow in the urinary tract. Additionally, studies conducted on animals indicate that parsley extract may increase urine volume and lower calcium levels in the urine, which may prevent kidney stones from forming. Furthermore, kidney health in general and kidney stone avoidance may benefit from its inherent diuretic qualities. In addition, parsley juice is rich in vitamins, minerals, and antioxidants like tannins, coumarin, and carotenoids, which are all good for the kidneys. By supporting kidney function and aiding in the removal of pollutants, these nutrients maintain a clear and healthy urinary system. The diuretic qualities and nutrient content of parsley juice have the potential to avoid kidney stones and promote general renal well-being, even if scientific data regarding its direct effects on kidney health is still developing. Juice from watermelon. Citrullus lanatus, the scientific name for watermelon, is a popular fruit in markets because it grows well in warm, temperate climates. Did you know that renal health can be enhanced by watermelon? This delicious fruit stimulates your kidneys softly because it contains natural chemicals with modest diuretic characteristics. Watermelon contains an abundance of vital nutrients, including minerals like iron and vitamins A, C, and K. Furthermore, its potent antioxidants, citrulline, lycopene, beta-carotene, lutein, and zeaxanthin, vigorously oppose deleterious free radicals and protect your kidneys from harm. In particular, citrulline causes your blood vessels to relax and dilate by stimulating the creation of arginine. This keeps your kidneys supplied with enough oxygen and nutrients and facilitates smooth blood flow. Previous rat studies have demonstrated that watermelon rind enhances antioxidant defenses, protecting the liver and kidneys against damage. Thus, the next time you juice watermelon, don't forget to include the rind. You are not only enjoying a refreshing beverage when you sip watermelon juice, you are also nourishing your body and kidneys from the inside out. Juice from pineapples. The tropical fruit pineapple is used to make its juice, together with the fruit stem and root. Its enzyme, bromelain, is what makes it beneficial. Fun fact, bromelain works well as a marinade because it has the ability to soften meat. Additionally, because of its high vitamin C content, this enzyme strengthens the immune system, promotes heart health, and lessens pain and inflammation. Everything is good for your kidneys. Pineapple's low potassium content and high content of vital minerals like vitamin C, manganese, and fiber help it fight free radicals and support kidney health. Pineapple is a fruit that cleanses the kidneys because of its anti-inflammatory qualities, which reduce swelling and inflammation with each drink. Put simply, the enzyme bromelain reduces kidney inflammation and enhances general health by specifically targeting prostaglandins that cause inflammation. It doesn't stop there, though, as clinical research has demonstrated how well bromelain works to reduce pain and inflammation and provide real relief. To receive the benefits without going overboard, stick to recommended pineapple serving amounts such as 1-2 cup of fruit or 4 ounces of juice each day. Your kidneys will be grateful if you now enjoy a glass of pineapple juice as a taste of the tropics. Here is our selection of the top 10 drinks to have when trying to cleanse your kidneys. It's crucial to emphasize that even if these beverages are all fantastic, all drinks include both beneficial and harmful components for the kidneys, so don't limit yourself to just one. It all comes down to moderation, variety, and balance. There are a few additional kidney cleansing related things to be aware of now. Precautions for kidney cleanses, also known as renal detoxification. Kidney cleansing is a popular procedure that is praised for its ability to improve kidney health and detoxify the body. Although kidney cleansing seems like a promising approach, there is still a dearth of scientific evidence to support its efficacy. What's more worrisome is that kidney cleansing can be dangerous for those whose renal function is compromised, even while it may be safe for others with healthy kidneys. In individuals with compromised kidney function, Bowel cleansing, which is occasionally performed in conjunction with renal cleansing, can result in severe hyperphosphatemia or high blood phosphate. Keep in mind that hyperphosphatemia can be fatal. Furthermore, severe renal cleansing methods like fasting or severe calorie restriction would leave one with crippling exhaustion and pounding headaches. This is due to the fact that extended fasting periods carry a danger of electrolyte imbalances and dehydration that should not be ignored. Therefore, it's imperative that you follow these required safety measures before beginning any active kidney cleaning. Speak with your healthcare professional for advice that is specific to your requirements. Certain individuals may be more susceptible to issues like electrolyte imbalances or dehydration. Seeking tailored advice from your physician will help guarantee both safety and effectiveness. You can also get knowledgeable advice regarding dietary modifications from your doctor. The renal diet is one that can significantly enhance your kidney's health. It's a diet plan made especially to support kidney health, particularly if you already have renal problems. The goal of this diet is to maintain low blood levels of protein, salt, potassium, and phosphorus. To put it simply, your body may accumulate these nutrients if your kidneys aren't functioning properly. The dietary approaches to stop hypertension diet, or DASH diet for short, is another kidney-friendly alternative. It consists primarily of whole grains, lean proteins, fruits, and vegetables. This particular diet plan aims to reduce blood pressure because it's a common risk factor for renal problems. The DASH diet is recommended by the National Kidney Foundation as a way to delay the onset of kidney disease. Once more, the secret to responsible consumption is to practice awareness and moderation. The path to kidney health starts with eating a balanced diet and staying well hydrated. Natural kidney cleansing treatments like the fruit juices we suggested can be used safely and responsibly if you follow these easy guidelines and pay attention to your body's signals. From antioxidant-rich cranberry juice to hydrating apple juice, every beverage offers a different combination of nutrients to help our kidneys function. Even while these fruit juices might be beneficial, if you have renal issues, you should speak with a doctor before making any big dietary changes. Your kidneys will appreciate you taking the safety procedures we discussed a few minutes ago. Keep in mind that maintaining kidney health involves avoiding bad foods as well as consuming the correct ones. Remember to stay away from the 22 foods that can damage your kidneys if you have kidney disease. We would now want to sincerely thank each and every one of our viewers and subscribers. Your encouragement motivates us to keep releasing great material. Watch the video on the screen to learn about additional superfoods that can aid with kidney cleansing. You may already have some of the foods listed here in your kitchen. We'll also go over how to eat certain meals without endangering your kidneys. Remain educated and in good health.